And whatever part of the system you work in, work to understand it holistically, because there are so many players and so many opportunities to improve effectiveness and efficiency in the system.
When you were at Aetna and you were working with Jack Rowe, he's a physician. You came with an operations background. Can you talk a little bit about what that pairing was like?
Jack was a physician who came from running hospital systems. And I think Jack had the unique ability to know what he knew and know what he didn't know. Jack changed fundamentally our relationships with physicians in the healthcare community. I developed new products, new capabilities, fundamentally improved customer service, our strategy. I understood instinctively and from experience the power of a culture aligned with the strategy that unlocks the discretionary energy that each person brings to the job, but can choose to invest or not choose to invest. When Jack joined and when I got there the first year, we literally lost $1 million a day, $365 million at the end of the first year. When I left as CEO and chairman that year, we made $2 billion. And we created that profit by doing a much better job than our competitors so that our customers felt they were getting a really good value.
You came on as a leader in the healthcare space 10, 20 years ago. Do you think the skill set for what makes a great leader has changed?
When we think about leadership, we need to think about it in several dimensions. It's much more collaborative. There are many more stakeholders whose voices you have to listen to, including patients, patient advocate groups. And I think we have to recognize that the new generation of physicians are looking for a different kind of experience as a professional. New physicians say, look, I want to work, I want a job, I want to take great care of my patients, but I want to have a family, I want to do other things. And so the whole care delivery system, I think, has to accommodate that. Leadership has to be sensitive to that.
Going back to the idea of what the healthcare leader of the future should look like, I mean, what advice do you have for people who are starting their careers in this business now? Can they follow the same path that you had in your career?
I would look for new trends, new companies who have new ideas, who have an opportunity and are looking for a situation where you can have much more responsibility sooner. If it's a large established organization, sometimes it takes a lot longer to move through the chairs. The other thing is be a student of the system. And whatever part of the system you work in, work to understand it holistically, because there are so many players and so many opportunities to improve effectiveness and efficiency in the system.
What's the biggest risk you took in your career?
Well, the biggest risk I took, which for me was a defining risk at the time, I grew up in Chicago, and I had an offer from a great company, but it required me to relocate from Chicago to Minneapolis, Minnesota. Now, I was a kid from the south side of Chicago. I thought Minneapolis, Minnesota was the tundra. And so I thought about it long and hard, and I decided that the worst thing that happened was I went there, I took the job, I didn't like it, and I came back. What I learned was, in a year or so, I had made friends, I met new people, and it really turned out to be one of the best decisions I'd made.